Hey, how's it going, everybody? Sarasota Tim, coming to you from beautiful, absolutely gorgeous North Georgia, traveling as a YouTuber from the great state of Florida, Sarasota specifically, hence the name, Sarasota Tim. Thanks for watching my video today, and if you like what you're listening to, if you would consider subscribing to my channel, I'd greatly appreciate it. All those that are already subscribed and watching me for 6 years now, I greatly appreciate you very much. Here is a video I've promised to make about Medicare. I'm a 66-year-old man, going to be 67 in December, and I've been on Medicare for going on a couple of years now. And I found out a lot about it before I joined. You have to join, unless you have your own private company and you're still working and it's got at least, I think, 10 full-time employees. But otherwise, most everybody at 65 years old has to register and select a Medicare plan, even if you're not even on Social Security yet. You've got to select something about your Part B or Part A. Something about Medicare, you got to get on it. Most people do. I digress. So let's talk about it. You know, when you get to be 65 and you're on Medicare, let's say you're 70 and you've been on it for 5 years and you started at 65. That doesn't mean that you don't need to do what's going on right now. And right now, how you doing?
Are you going back to Nico Chevy?
You know, as a YouTuber, all kinds of crazy things happen. The guy pulled up and was asking me if I was waiting for a ride. He's doing some shuttling or something like that. But anyway, let's get back to the deal. You're 70 years old, you've been on it for 5 years, and you need today or until December 7th, every year from October 15th through December 7th, it's what they call open enrollment. And what is that? That's for people that are moving, going to be 65 and need to collect, get on it, or they want to see if they need to change. And some people get so settled in, they don't even check. And let me tell you, you're making a big mistake, because there is changes every year. In fact, mine has changed, and I'm going to talk about it right now. It hasn't changed to the good, but it isn't so bad. And I'm still going to stay with what I have, and I'll tell you what that is in just a minute. But if you're on Medicare, do yourself a favor and call 1-800-MEDICARE without the E, and that will connect you to an unbiased Medicare agent that talks about Medicare with companies like Humana, Aetna, United Healthcare, or any of the other insurance companies that offer Medicare. Specifically, the Advantage plan, or what I like to call jokingly is the Disadvantage plan, because you got a lot of myths out there that talk about what I do and what most Americans do. It's about down the middle, really. Are doing the wrong or choosing the wrong thing. But I'm going to show you, and you can decide for yourself what's best for you. So let's back up. It's open enrollment. It's time to find out, you know, do I still use you? Are you the best plan for me? You got to call them up and say, are my coverage is going to change? Are my co-payments going to be going up? Is mine going to be going down? Are you going to be paying me? That's right. They got what they call give back programs, and I'm on one, and I've been on one since I got Medicare. I started out with about $10 less, but I get $170 every month, all year long, added to my Social Security check. That's right. They will contact Social Security, and your Social Security check will go up if you get a give back program. Now, give back programs aren't everywhere. It depends on your zip code. I live in the great state, the sunshine state of Florida, where a lot of geezers live, a lot of doctors, and a lot of hospitals. So, you know, if you live out in the middle of nowhere somewhere, they may not offer a give back program. But Humana, which is a big one, does. And they give me $170 back in my Social Security. Social Security gives it to me, not them, but they will contact them for you, and you will see your check go up. Your deposit into your bank will then be that much higher. Now, you know, if you don't know, I'm going to let you know now, every single person on Social Security at age 65, when they get on Medicare, whether it's a supplement plan, which is one you pay for, I'll talk about that in a minute, or you get an advantage plan like I have and the majority of Americans have, that's a free plan. I got your attention now? Free, giving me $170 and free insurance? Come on. All right, I'll bite, I'll listen. What's it about? Well, I'm going to tell you. And this is the way I roll. So I learned about it watching YouTube, and I called a couple of Medicare insurance agents. I started out with Cardinal Insurance in North Carolina. You can look them up, Cardinal, and they can help you, or you can just call 1-800-Medicare without the E, and that'll get you to a licensed, authorized, unbiased person that will let you decide on what's best for you. So let's talk about the Give Back program. Humana and Aetna, and I think maybe others, depending on where you live, will give you from $50 to $170 back into your Social Security each and every month if you select the correct plan. And I was talking a moment ago that when you get on Medicare, there's $185. It's currently the price. It'll probably go up next year, another $10. It's been going up every year forever, of what they take out of your Social Security for Part B. Now, some people I talk to, they're like, I don't know what you're talking about. Well, I can tell you this. You're losing $185 and every other American that's 65 out of your Social Security. You don't lose it at 62 when you get your Social Security, but the day you turn 65 and you get Medicare, all of a sudden your Social Security check goes down. And currently, like I say, it's $185 that you have to give them, that you have to sacrifice from your little tiny Social Security check. They take $185. Bam! You just got the big reduction. And then these increases they give us every year are a joke. $10, $20, $30, $40. Then they raise the Part B even a little bit more. You end up netting $20 more. It wasn't until 2022 or 3 or 2021 was the first time in 40 years we ever got such a big cost of living increase. But I digress. Don't look for those coming in 2026. Look for like basically something that's not even worth mentioning. But on Medicare, when you become 65 and you got to start losing $185, probably closer to $200 by next year, out of your Social Security, that's a pretty big chunk. And then if you decide that you want to get Medicare, but you don't want to get a free one because you listen to the naysayers saying that that insurance is no good, they'll let you die. They'll let you lay on a bed and stall and drag your feet and not approve medical coverages and surgeries and things that you need. They'll tell the doctor, we'll get back to you on Monday. Meanwhile, they hope you die. That's all hogwash, folks. Don't believe any of those people that say Medicare Advantage plans are any less good than a supplement plan. The only time there's any difference is other than limited doctors you can see, depending on if you have an HMO or PPO, I'll explain that. But if you have a traditional supplement plan, not only are you going to pay that $185, boom, less money out of your Social Security check, you're also going to pay for your own insurance, like you've done your whole life. They're going to say, oh, don't get the Advantage plan. They'll let you die. They won't approve anything. You'll never get services. Get this one over here that costs you anywhere between $200 and $400 a month, and it gets no dental, no hearing, and no vision, and no prescription, Part D. You still have to pay $10, $15, $20, $25 a month for each one of those if you want them. They're optional, but if you want your prescriptions covered, most people get that. So now you pay the $185, then you're giving them $200 to $400 a month for a supplemental, a traditional Medicare plan called traditional Medicare that is called the G plan. And it doesn't matter who sells it to you. A G plan is a G plan. You can go to any doctor that accepts Medicare in the United States of America. It doesn't matter where you're at. You walk up to a doctor's door, and if it says they take Medicare, you're in. Well, if you have the Advantage plan, just like when you worked, traditionally you can get a PPO and an HMO as well when you work for an employer. Is that on? Yeah, we're on. You have to go like in your zip code or an area of doctors that are within your plan. So it's not a nationwide coverage generally on when you work for somebody. But if you have a PPO, you have a few more choices than, hey, only these here. So it's the same way with Medicare when you take an Advantage plan. You can get an HMO and you can get a PPO. So what's the difference? On Medicare HMO, you get only the doctors that are in your zip code, where you live. Your primary, the specialist that you might need for a dermatologist, an eye doctor, cardiologist, whatever. You're going to have to choose one that's in your list. You might call one and say, yeah, we take Medicare, we take Advantage plans, but only the PPO. So that's what I have. That gives me, because I travel as a YouTuber, that gives me the choice, even when I'm at home and not traveling, that broadens out the amount of providers to a lot more, and I'm covered only to people that accept the PPO Advantage plan in other states. But it's like 50,000 providers across the country. So you tell me, when you got that kind of coverage, what do I need to pay $200 to $400 a month for an Advantage plan, not get a give back program and lose my $180, my $170 a month that I'm getting back now, plus pay for that G plan, plus pay for vision, dental, hearing, and prescription drugs, when I can get a PPO free insurance plan, free. Doesn't cost you anything. Even if you don't get $170 a month or $50 a month or $100 a month, and they don't even have a give back program. Like my friends that I know, they have Aetna. They get nothing back in their Social Security, and they have to give that $185 away like most people do. But that insurance doesn't cost them anything, and they've had knee surgeries, hip surgeries, heart surgeries, eye surgeries, dermatologists, everything. And no one's ever dragged their feet and said, we won't give you coverage. And they have PPO. They choose what doctors they want to go to. So what's the difference? Well, find one that's an Advantage plan is my recommendation. So you don't have to pay for this program. You just get free insurance. Then you decide, do you want one that has doctors that are right down the street from you and you don't care? You know, they're a doctor. You can go to them, and there's other specialists if you need a dermatologist, and you just get an HMO. You're not a big time traveler, and if you need hospitalization, you can always go to emergency. No matter where you're at in the country, if it's a true emergency, you're going to be covered. Otherwise, you need to go to the people that are in your plan around where you live. If you get a PPO, it doesn't cost you anything. You might, get a give back. You might not get a give back. It might have a higher out-of-pocket every year that you could be responsible for, or a higher copay. Instead of $20 or $30 for a specialist, you might pay $45. Instead of your prescriptions being covered like 100% from the get-go, unless it's a real expensive prescription, then there's a co-share there. You might have to meet a $400 or $500 deductible. Pay for that many prescriptions before they start even helping you. But you'll be getting the give back program. And that's what I've done. I'm going to tell you exactly what I have in just a moment. So, traditional Medicare costs you money. You get no chance of a give back program. You got a 100% chance you're going to pay for it. It's going to cost you $200 to $400 a month for the Medicare G plan. That's kind of like what everybody gets. But you got to buy it every month. You lose your $185, and then you lose $200 to $400 over here to this insurance company. And you pay that the rest of your life. And they can raise that cost. That's why you need to call, if you're on traditional Medicare or an Advantage plan, 1-800-Medicare to find out if the G plan, if that's what you're on, is cheaper somewhere else. Because it doesn't matter who sells you a G plan. This is one thing I got to defend traditional Medicare about. If it's Aetna, if it's Humana, if it's United Healthcare, and you're buying, if those are the companies, I don't know who they are, but if you're buying traditional Medicare, they have to do the same coverages on the G plan from anybody. The only difference would be the price. So you definitely want to get the lowest price for the same darn thing, right? Why would you want to pay another dollar for something that's going to do no more than what this guy will do or this program will do for less? So anyway, the Advantage plan, let's get back on that, which is what I have with Humana. And my $170, they call it a give back. Why do they do it? Heck if I know. But I get it, and I've been getting it for 2 years. And I've been to the doctor, I've had 2 eye surgeries, I've had dermatology done extensively, I've had all these things done. And what do I pay? I pay $45. It used to be 30. Then last year it went up to 45 to see a dermatologist or the eye doctor or the cardiologist, any doctor called a specialist. You go to the primary, free. You get your blood work done, free. You get all these tests done they want you to do to make sure you stay healthy, free. In fact, if you do the things you're supposed to do, they give you rewards and give you money to buy medical goods like blood pressure monitors and canes and Advil and Tylenol and a whole assortment of medical supplies free of charge. You can earn up to $500 a year, pay for eyeglasses, just different things if you just do the things that they think you're doing so you can stay healthy. Because they don't want to have to cough up any money for somebody that just doesn't stay healthy. So you're rewarded by staying healthy through the Advantage plans. They don't give you anything on traditional Medicare because they just want you to pay, and then when you go to the doctor, there is no other fee. There's $185, I think, every year when it begins, the new calendar year, that you will have to pay. A copay, a deductible, whatever. They do gotcha. You got to pay that. And then after that, it doesn't matter how many times the doctor you go to, primary, specialist, it doesn't matter. You walk in, you throw that gold card down, and they say, you're good. You don't owe us nothing. But that insurance company has got their hand out every month waiting for their $200 to $400. So is the company that's giving you eye coverage, dental coverage, hearing coverage, and your prescription drug coverage. And you add all that up, plus losing that $185 without a give back program, and you're spending $5 to $6K a year, up to, for the rest of your life. Now what about years when you go scot-free? You don't even see a doctor. You don't even need a doctor. I quit the doctors. I'm not going back to them. They're gonna have to wheel me in on it. I'm gonna have to be horizontal before I go see a doctor again. They're nothing but a gimmick. You go in, they got all these things. They're like, you're a new customer, right? Well, every cured patient is a lost customer. So they never want to fix anything right away. They're just like, okay, you got good insurance, right? You got that G plan? All right. You got the Advantage plan? All right. Here's what we need to do. First we do this. Then you come back in 2 weeks. Then we're going to do this test. Then we're going to do this test. And then we're going to get you on a Stalin pill, statin. Then they're going to get you on the blood pressure pill. I watched a video this morning on everybody's checking their blood pressure wrong. 11 reasons why. And one is your arm has to be up here. It has to be the left arm. You got to have 5 or 10 minutes rest. It's got to be a cuff. It's got to be on the skin, not on your clothes. You got to have 5 or 10 minutes rest. And you can't have caffeine in your body. You can't have any of these things that will give a false reading, and then they want to just prescribe blood pressure pills to you because you're getting false information. So most people take blood pressure at home and at the doctor's office incorrectly. Look it up on YouTube. A doctor just showed this video today, and I believe him. And so half the people out there on hypertension medicine shouldn't even be on it. And your blood pressure can be 10, 20, 30 points higher than it really is, you know, than when you go in and they take it. So anyway, that's another thing. I digress. So I've got the Humana Give Back program, and I've been on it for 2 years. It was $160 or $150 when I lived in the East Coast in West Palm Beach. And I moved over to Sarasota, Florida, and to my surprise, it went to 170. So like I said, it depends on your zip code. My copays did go up from $30 for specialists to $45. I've had a lot of people in my community that comment that like to, make fun of the disadvantage plan, talking about how specialists are going to be $70 every time you go to the dermatologist or any specialist. Not true. They've already got all the plans because it's open enrollment. All the plans are etched in stone that take effect January 1. My plan, my deductibles for, or copays I should say, for specialists are unchanged. But what did change is my prescription drug coverage has a higher deductible that I have to meet before they kick in. And they still don't pay 100%. But I'm getting that $170 every month, and I only have to get these prescription drugs every now and then. So I'll take an every month guarantee of $170 versus the increase I might have to pay for a prescription drug every now and then. And then the deductible, the medical deductible, it went from $275 to $500. What is that? Well, every time you do pay a $45 copay or anything that comes out of my pocket, go towards that. So you're getting an increase in how much each year now, another couple of $100 that I'll have to pay in copays. But that means I've got to be seeing a doctor a heck of a lot more, and I don't. So this is only relative if you go to a darn doctor. If you're healthy and you go the next 2 or 3 years until you get really old, until you need a new clutch or brakes, you're not going to be spending this money. You're just going to be getting the $170, the give back. And that's what I'm all about. I'm all about how much you're putting in my pocket, not how much you're taking away from me and then make me want to buy insurance when I can get the same thing the guy over here paying. I can go to the same hospital and get fixed, and likely by the same doctor as this guy over here that's paying them every month. He might go 5 years and never even use it. He's a Jack LaLanne. He's healthy, but he's got plenty of money, and he heard the Advantage plans are no good. So he spends out $400 or $500 a month. He's got vision, dental, hearing, and the prescription drug plan. He's got the G plan, and he's spending it's an expensive one, like up in New York and stuff. They're really expensive. Some people talk about they got a G plan that runs them $150, $200 a month. But look, that's still something. I don't want to pay $200 payment the rest of my life. I don't want to pay $100. So, but you can't convince people. So let them do them, and you do you. But one thing I can tell you is I'm staying on the Advantage plan. I've been to the doctor enough times to know I don't want to see him anymore. It's a rigged system. They all want you to come back and get more tests. They don't want to cure you, because then you're a lost customer. It's all about revolving you around the door and telling you you got these things. And guess what? Everything we've been taught, a lot of stuff about medical, like cholesterol, blood pressure I mentioned a moment ago, is a big myth. They're doing it wrong. They're checking it wrong. That's why they went to college for 8 years. They want to make money. And then they don't even want to come to work except to do the surgeries. They got these nurse practitioners doing all their work for them, and they're just writing orders. Yeah, give them this. Tell them to take that. While they're sitting on a golf course somewhere. Believe me, folks, it's a scam. But if I got my leg broke, or I got in a car wreck with my truck today, and the ambulance had to come take me to the hospital, I darn sure want to make sure that guy's got a PhD and he knows how to fix me. In that case, that's different. But these things where you go to the office and do these routine checks, and they do a C-scan, a CAT scan, and a calcium score. Mine was 5,000. I'm hiking mountains over here in the Smoky Mountains for the last month, day after day. I'm hiking every day now, or not every day, but most days. Your calcium score is supposed to be 1, 2, 3, 4. I had a 5,000. They're like, get to the doctor quick, hurry up, go by ambulance. You might die before you get there. People were freaking out. They had me on these tests at that cardiologist. Baloney. I threw it all away. All them pills, I stopped taking them. I went on the carnivore diet. I digress, but I'm not saying that's what cured me, but I never had anything. I'm just blessed. Now, not everybody's like that. You know, every day there's people walking around with oxygen tanks, canes, walkers. You know, they might be getting up in the years too. There comes to be a point where, yeah, you're failing. You're falling apart. The wheels are coming off. But right now at 67, almost 67 years old, I'm crushing it. And when I called Humana this year, which I will again next year, I just want to know, do you have any more? Is it going down? Is my plan changing? And when I called 1-800 Medicare, I said, is Aetna got a better deal? I'll switch. If they got more of a give back program, I don't care who it is. Turn me over to the next one, because it doesn't take effect until the first of the year. And you can change your mind as many times as you want. But right now is open enrollment, October 15th through December 7th. Call 1-800 Medicare without the E. Get somebody on the phone. Give them your Medicare number. Or if it's your first year to select Medicare and you're turning 65, call them up. Ask them, first of all, do you got a give back program? Do I can get money back into my Social Security? Because at 65, they're going to start hitting you. Almost $200 are going to come right out of your Social Security now. You're going to see your check go way down. Welcome to 65. But if they got a give back program, like it's $185 right now, I'm getting $170, $15 is what they reduce my Social Security from the Part B. That's what it is currently. And then in 2026, the Part B might go up to $190, $195. And so I'm still only going to get $170. That means I'm going to lose another $10 or $15. And I'll be up to $20 or $25 I've got to pay for that Part B. But it's not $185 that they're going to take out of me for the rest of my life, out of my Social Security. So that's the video, folks, about Medicare. There's only two ways to go, two paths to take every year from October to December. And at 65, when you got to decide, do I go this way and pay them money for insurance, or do I go this way and take the free one called the Advantage Plan? And if you've got a TV, they are wearing you out on the air channels, the antenna channels, every 5 minutes on getting these Advantage Plans. It's highly promoted, highly. And why is it free? Why do they give you money back? Well, I'm going to speculate here and say, when doctors can get away with just, on traditional Medicare, with just saying, order this test and give these pills, or he needs that, or do this surgery, the government doesn't check these doctors. The amount of fraud that is committed by doctors every year to the government, requiring unnecessary surgeries, medications, diagnoses, is in the billions. If you look up the third leading cause of death in our country, it's not heart disease and cancer. Those are the first two. The third is going to the doctor. Medical errors are the third leading cause of death in the United States. Look it up. And people have argued with me on that. Normally it'll tell you that's it. But if you put in, is medical errors the third leading cause of death? Ask any AI or Google or whatever. That's what you're going to get. So why would there be that much over everything else of people dying? Because doctors, for the most part, it's a business. They don't even want to spend time with you anymore. They certainly don't make house calls. So if you want to stay healthy, eat healthy, think healthy, live healthy, pray to Almighty God, and that way you'll crush it.